When we begin patient assessment. Patient assessment is a subject that to me is very important and also very exciting because this is where we begin with actually being able to treat patients and manage their various medical problems. So this video will serve as an overview of patient assessment, and then we'll break it down into its individual components from there. So your assessment of your patient is the basis of everything you will do for your patient. So the entire patient assessment segment will be broken down into its individual components of scene size up, primary survey and resuscitation, history taking, secondary assessment, and reassessment. So everything that we do will be in one of those categories. Performing the patient assessment will require you to critically think about the presenting signs and symptoms that the patient is exhibiting. So let's talk about what the difference is between a sign and a symptom. So a symptom is any condition that the patient tells you about. You may not necessarily be able to see this. For example, pain is a symptom. You can't necessarily see their pain, but the patient can tell you about it. Their inability to move, a fever, or palpitations. A sign is something that you can observe about the patient. Some examples include a laceration, an obvious fracture, or blood pressure, pulse, respirations, and the vital signs. So as we begin looking at the patient assessment, still as part of an overview, I'll go through each segment and summarize what we're going to do, and then there will be multiple videos for these different segments. So in your scene size up, this is where you will take standard precautions, and we will talk about that. You'll ensure scene safety and situational awareness. You determine the number of your patients. Determine the mechanism of injury or the nature of the illness. You'll consider the need for additional or specialized resources, and you'll also consider the need for spinal immobilization. Next will be your primary assessment. In the primary assessment, you'll form a general impression, assess their level of consciousness, assess their airway, breathing, circulation, and identify and treat life threats. You'll determine the priority of patient care and transport, and you'll generate an initial differential diagnosis. And we will talk a lot about the differential diagnosis. The next segment will be history taking. This is where you'll investigate the chief complaint. You'll look at the history of the present illness. You'll use the mnemonic OPQRST. And again, when we get to the history taking segment, we will define those and talk about those. And you'll obtain a sample history. Sample, again, is a mnemonic, and we will, again, talk about those when we get to the history taking segment. The secondary assessment is a systematic assessment, whether it be medical or trauma. And we will assess vital signs using a variety of monitoring devices. And again, we will get a lot more specific about those. And then finally, we'll reassess. This is where you repeat your primary assessment. You reassess vital signs and chief complaint. We recheck our interventions. We identify and treat changes in patient condition. We reassess unstable patients every 5 minutes. That's a key. You'll need to remember that. And we'll reassess stable patients every 15 minutes. And again, that's a key time frame, and you'll need to remember that as well. So the next several videos will dig into these individual topics more deeply.